Endometriosis is a condition that affects women, and basically there's uterine tissue outside of the uterus, and so when it's where it doesn't belong, it can break down and cause pain and bleeding. Not everyone with endometriosis will have symptoms, but most women do have lower abdominal pain, and they may notice that this is more pronounced either before or during their periods, anytime during their cycle really, after sex, and sometimes it can even be associated with having a bowel movement or with urination. If you've had any of these symptoms, talk with your doctor, and after asking you more specific questions, then they'll be able to decide if they feel like it's endometriosis or something else, because of course these symptoms can be due to many other things too. There's not a specific test for endometriosis. It's a diagnosis made off of the conversation that your doctor is able to have with you. They'll ask you about how you feel, what your history has been like, and then they'll be able to decide what it is. The only sure way to know if you have endometriosis is to perform surgery. The doctor can actually go inside the abdomen with a little camera and look for the tissue that's in the wrong spot, and then they can remove it. And sometimes this helps to alleviate a woman's symptoms, and sometimes it also helps women who have had infertility in the past, because one of the other things associated with endometriosis is infertility. So the treatment for endometriosis will depend on whether or not you're wanting to have babies at this point in your life. There are certain medications that can help, but again, it depends on whether or not you want to get pregnant, because some of those medications will make it so that you can't get pregnant, like birth control. Birth control pills can reduce the symptoms, but of course you're not going to get pregnant while you're using that. So sometimes the doctor will recommend certain pain medications to help you with the symptoms, and then if you're trying to get pregnant and aren't able to, then they can work with you on the infertility side of it. Good luck with everything, and if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.